My name is Chris Sattler, and I'm from Waxahachie, Texas. The discomfort and pain that I felt before I had my surgery was a lot of inflammation, swelling, and like when I'd get up first thing in the morning, or if I did a lot of sitting, it would get really irritated. And so movement is the best thing, but long periods of movement, like walking long miles, caused a lot of discomfort in my SI joints. And so I would get SI joint injections, and after a while they would last roughly about 3 months, but then sometimes if I was super inflamed or in a lot of pain, they would only last like a month. And then my insurance started to put a cap on how many I could get per year, and so I really wanted to fix the pain and not just have a temporary steroid shot and then be in a lot of pain. So I went forward with doing the fusion. So what made me go forward with deciding to do the SI fusion, like I said, is that I was only allowed 4 injections per year, and it started to become more painful and the shots wouldn't last as long. I used to could go 3 months before needing another steroid shot, but then it started getting to where it would only last a month. And so that wasn't going to work, where I could only get 4 for the calendar year. So I see these procedures done daily at my job, and so the doctor that I work with decided that it's best to do the fusion. So I went ahead and decided to do it, and I'm very happy with the results. I got about 90% relief on my left SI, and I'm currently 2 days post-op on the right. So 2 weeks after I had my left fusion, me and my boyfriend went to the fair, and we walked long miles, like probably 6 or 7, and I noticed that I wasn't in a lot of pain like I normally am. When I walk a lot, my SI joint would get irritated and inflamed and even cause pain up my back. It never radiated down my legs or anything, but I did notice after my fusion I didn't have that swelling and discomfort that I normally have before then. So I noticed a big difference. And then I have a part-time job that I work on the weekend, and I walk like 8 to 10 miles working 16 hours, and I notice a big difference that I have about 90% pain relief from the fusion on the left side. And right now I'm 2 days post-op on the right side, so I don't know the pain relief yet because I'm still in the recovery process. What I would like to tell others about having the SI fusion is, yes, it can be scary that you're getting 2 screws placed into your SI joint, but the pain is not as bad as I thought it was during recovery. Like, yes, for 4 to 6 days it's a little rough, but the amount of pain relief that I have from stabilizing that joint is wonderful. Like, I would do it again and again, because it definitely has helped my pain 90%. So yeah, my incision on my left side is about like 1.5 inches, and it's lateral, so it like goes along with my hip, and you really can't tell because in the crease of where it's at, like it's where your shirt would lie or your underwear would lie. So if you're wearing a bathing suit, nobody would know that I've had the surgery. And then my doctor does stitches, so I didn't have staples, so I had internal stitches and then Dermabond placed on top. And then I just let the Dermabond come off whenever it was time. I didn't pull it or anything to make sure the incision healed very nicely. And then in that area, since it won't get sun, the incisions should be very unnoticeable. For the recovery, my doctor doesn't want me starting to exercise until I'm 6 weeks post-op. One thing that my doctor does is we place an abdominal binder on after surgery to help stabilize and make the patient realize that they had a procedure, to not be overdoing it. And it actually, the abdominal binder does actually help with the pain and swelling. So I would recommend that. And then once I'm fully healed, I'll start working out. So how satisfied I am with the SI fusion, I would say a 9 to 10. Like I said, I'm 2 days post-op on the right and 6 weeks on the left, and I would do it again to feel the relief that I feel. So I feel like it's going to make a big difference once I'm healed on the right side, that I can get more active and not deal with all the inflammation and pain that I dealt with every day.